Okay, I think we'll go ahead and proceed. Just as you're aware, we are recording this session, so behave. Uh, I'll tell myself that. So welcome everyone. This is the sixth session we've had for presidential address. It's kind of by way of update. I'll go through most of the slides. Hopefully Justin Rubel, our HR person, will be here. He has 3 or 4 slides to go over with you as well, 3 or 4 PowerPoints. And then, as always, at the end, I'll tell you what we'll do is at the end of when both Justin and myself are done and complete, then we'll open it up for any questions. Usually takes about 45, 50 minutes. We'll leave about 10 minutes for questions. Smaller crowd, so maybe we even get done a little quicker. So I'll go ahead and begin. I've been here 13 years, and when I first started, the goal here was to do a cultural integration between Jefferson and Berkeley hospitals, and we definitely have achieved that. And so we work together and act as one hospital. But now, in the last 4 or 5 years, we've had definite more integration with WVU Medicine. So I'll show you exactly what that means and how we have integrated as a true hospital system. The outline is addressed first as integration. As part of that, Justin Rubel will explain some of the benefit harmonization, some of the benefits that we have and are going through. Certainly finances, services. Ford Motor Company says quality is job one. Healthcare's job is even as important as that, if not more. And then some of the strategic planning, and I have some of the drawings and things that we hope to do in the next year or two. So it's kind of an outline of what I'll be addressing today. So the integration is with 11 hospitals now in the WVU health system, starting with, of course, Ruby in Morgantown, Camden, Clark, Parkersburg, Berkeley, of course, United just south of Morgantown, and Reynolds and Moundsville. So those are the 5 community hospitals. What's been added is quite a few of the critical access hospitals. Of course, Jefferson's been on board, Potomac, Braxton, St. Joe's, Somersville, and Jackson. We also manage and help manage a lot of other hospitals. The most recent one that we began, WV Medicine began managing was Wheeling Hospital in Wheeling, West Virginia. Now, if you haven't heard, the other hospital across the street, literally across town, Ohio Valley, is planning to close. And Eastern Ohio Regional is also planning to close as part of that system. And so that will create a tremendous need and importance for Wheeling Hospital, of course, in Moundsville may help that out. We also manage Wetzel County, but that's on the eastern shore, and all the way south as Somersville. So you see all this northern portion of West Virginia consumed by either ownership or management contracts or provision of services for these other hospitals. So that kind of gives you an idea of all the managers of this cultural integration between Jefferson and Berkeley. Most of us are responsible for both hospitals, including myself, but you see Morgantown. So I'm in Morgantown 3 Wednesdays a month. Finance is there 1 or 2 Mondays a month. IT actually lives in Morgantown. So we do have a relationship, obviously, with the mothership Ruby in Morgantown and the healthcare system. In addition to that, through WV Medicine affinity groups, we help organize and bring together all 11 hospitals for best practices and things of that nature to try and do best practices, and bringing all 11 hospitals together certainly helps achieve that goal. This is the integration with all 3 players, from administration to quality to the HVI and legal and neurosurgery and things that. Future integration, we're definitely integrated now with cancer services. Any and all clinical trials go through Morgantown Cancer Center. The radiation oncologist in Morgantown, locally we have a shared venture with Century 21 for radiation oncology, but we coordinate that through a board of partial members in Morgantown and here, and certainly Century 21, to achieve the provision of radiation services locally. HVI, the Heart Vascular Institute, is headed up by Vinay Badwar. He's in charge of that. My goal in life in Berkeley, Jefferson County is to accomplish what I call 3, 3, 3, and 4. 333 and maybe 6, and that is simply we employ three interventional cardiologists are employed and working out of Winchester. They help cover STEMI call here. We have a need for 3 interventional cardiologists in Berkeley. We have 1, so we're in the process of recruiting 2. Hopefully have 1 close to signing. And then we have 3 non-interventional cardiologists that we hope to recruit as well. 1 is hopefully will sign by literally the end of the week or not. So, and then the last category is 6 advanced practice people that will help augment and supplement the cardiology practices. Neurosurgery, Ali Rezai, who chairs that in Morgantown, but a gentleman named Mark Lee, a pediatric neurosurgeon, is here literally once a month and helps advise us on any and all neurosurgery type items. And we now have Dr. Caruso, who started a year ago, and Dr. Mark Lyerly started about 2 months ago. And Dr. Mark Lyerly has a friend in North Carolina that will have dinner with us next Tuesday evening. So any of you in the OR, he'll be around visiting MOB3, and the OR is downstairs, and hopefully we'll be successful in bringing in our 3rd neurosurgeon. We have 2 the best pain management people there, Dr. Ishigami, Dr. Foster, and so we hope to augment them or supplement them with 1 additional pain management as well. We're in the process of recruiting for that. Neonatal intensive care unit, as some of you may know, when I went to finance about 8 years ago, they told me that you would lose your shirt if you own or if you start up a NICU here. We started one up. I not only lost my shirt, I lost my jacket, my pants, and everything else in between. And so it's not been a financial thing, but you know, as I always equate, the football team will support the lacrosse team at a major university. So we make money elsewhere, but help that. I can also say the ROI for neonatal is simply that there are 12 children living today that probably would not be living in the last 5 years. So it's been very good, and hopefully help the mothers decide and define that they will have their babies here versus going out of state as well. We are 30-week gestation, level 2B. I'm hoping within literally 3 to 4 weeks that we convert to a level 3. Level 3 being 28-week. We're already there, as most of you know. Level 3, B, C, and D is some of the specialists coming in, and we need additional specialists, either by telespecialists, as I call it, tele-NICU, or by whatever means, but bring them in. And from a reimbursement standpoint, it literally triples our reimbursement for the reimbursement of children. We are licensed and certified at 4 beds, and today's 4 beds, bassinets, babies, and today's census is 9. IT, you're quite aware of Epic, and then a lot of hospitals that plan to get into population health and act more like an insurance company. It's hard for sometimes hospitals to manage an insurance company. It's difficult for an insurance company to manage a hospital. So what do? The hospital, unless you're UPMC, the hospital buys an insurance company, and we have purchased a health plan out of Wheeling, West Virginia. Justin will go over the health plan. Major medical will be one of your options, side by side to Highmark. And so he'll go over the particulars about that. So it's more prominent in the Eastern Shore outside of Wheeling, because they are hospital or Wheeling based, and so they will help that as well. So we'll continue that. So there is the health plan. Headquartered in Wheeling, headquarters will remain. The deal is not done yet. There's some new other due diligence that will need to occur. But they are licensed to do Medicaid, MCOs in the state, and some of the PEI plan options, and so forth and so on. So we will, hopefully they will help us attain the efforts of population health and things of that. Benefit harmonization, HR and I previously tried to coordinate what benefits Berkeley had and what Jefferson had 8 years ago. For 6 years we were unable to do that. HR in Morgantown was able to do that for 11 hospitals, and it's accomplished for the most part. So your major medical is the same, your days off the same, your retirements are all the same. So for all 11 hospitals, it's standard or harmonized throughout the system. What we did start several years ago is this WVU tuition free. So if you have been with us 5 years or greater, your children can go. There's other requirements, of course, having better grades than what I did, but basically having decent grades and going to WVU tuition free. I believe we have close to 48 students that are enrolled of our 2,200 employees that are going to WVU, and I'm picking up the tab for the tuition. I will now, if he gets up here, turn it over to Mr. Rubel. And we, the benefit overview, Brian Guyton will be on site to explain all of this under the open enrollment. So he'll be able to pick you up, I think, on that. Will be okay. Here, he has a mic on there, so if you get a little close to that, you're good.
Perfect. Good afternoon.
Hi.
So as a little bit what Tony alluded to, we spent the last 2 years going through a benefit harmonization across the system in order to leverage our economies of scale. So essentially now, regardless of your employee status or where you work, any facility, you have access to the same benefit plans. So essentially that has exponentially increased the opportunities for our employees with the benefit plans that we do have. With that being said, a couple different things that are going to occur. First off, open enrollment is October 30th through November the 12th. It's the same 2-week period every year now. That is standardized. With that being said, the benefits team will be on site for benefit information sessions to prepare you for open enrollment. That will be October the 29th here at BMC, this very room. 7:30 a.m., 11 a.m., and 3 p.m. are the open enrollment information sessions. They'll last an hour to maybe an hour and a half. And then on October the 30th, the day actually open enrollment starts, we'll be down at JMC, 7:30, 11, and 2 p.m. So 6 opportunities. There's also going to be probably live webinars, recorded sessions. There's going to be emails, and there'll be flyers sent to your mailing address on file as well. So a lot of ways to get that information out to you. With going through that large-scale harmonization project the last 2 years, this year's really entering a stabilization period. So I'm here to announce there's not many changes going into next year because all the vendors that we're with are new and the plan designs new, and we've done a good job of controlling our cost. So I can announce to you that as of this time, there are no planned cost increases for premiums or deductibles on the health insurance plan. Round of applause now, please. Thank you. All right. There are some small changes related to co-pays for ED, trying to shift a lot of that business or traffic to the urgent care if it's not of an emergent nature. Some different or newer benefits, I should say, for obesity and weight control, given our population of our employees and the health of West Virginia. So those will be new accessible benefits, and then a slight increase on the dental plan. Everything else, as far as pretty much the vendors and the co-pays and the cost shares, will remain the same, and there will be a change in the pharmacy benefit manager away from Highmark Blue Cross Blue Shield, which should also exhibit, cost savings for both the organization and the employee as well. So the integration of the health plan, as Tony alluded to, so there's still a lot of due diligence. It is not finalized by any means, but at this juncture, there is the intent for the health plan to become the administrator of the 90% plan. So as you know, we have 3 health insurance options. The 90% plan is, I call the rich plan. You pay the most for it pre-tax out of your paycheck, but it covers you at the most. Then there's the 80% plan. I call that the market plan. That's kind of what you find in the market. Many employers offer an 80-20 or a 70-30 cost split. The 80% plan is the middle plan, and then the high deductible health plan. So what will happen is the health plan will administer the richest plan, the 90%, and Highmark Blue Cross Blue Shield will continue to administer the other 2 plans, and that's because we have a contractual relationship with them for a 10-year period with a certain spend basically required. So therefore, the network doesn't change though. So we still have the WVU Medicine enhanced providers and facilities. That is the highest level of network coverage. So whether you have the health plan or Highmark, that remains the same. What will be different a little bit is the standard network that they have, or the participating providers. That's a little bit different for the health plan versus Highmark Blue Cross Blue Shield. Both are nationwide, but Highmark Blue Cross Blue Shield is a bit more established. They are one of the largest health insurers in the country. So that's one consideration that you'll want to think about when you're going into open enrollment for next year and determining, what is the best health insurance plan for yourself and for your family. As I discussed, a couple of different reasons for not having any cost increase for premiums and deductibles is the way we're managing the plan, and one of those was the dependent audit. Now that's probably seen as a bit painful because you're looking for your spouse's, maybe your marriage certificate or your tax information from the prior year and having to reproduce that. And you've been an employee for 15 years. We heard that a lot in HR. We understand that, but there's a reason we do it, and that is to protect the integrity of the plan and protect you as employees, because if there's dependents or spouses or anyone else on the plan who isn't truly an eligible dependent, that costs you and it costs the organization. And this year was to the tune of $1.3 million to include approximately 40 dependents that were not eligible across the East. 6 of those were high claimants with costs over $50,000. So we're all sharing in those costs. So by going through this process to ensuring the integrity of everybody that's on it, by having those cost reductions ultimately allowed us to keep the premiums pretty much stable going into the next year. And we are a rich plan in terms of what we pay versus what the organization pays versus the employee. Right now it's about an 85-15 split, and that's because a lot of our employees, 70% actually, are in the richest plan, that 90% plan. So what that really means is our competitors, or the book of business in Highmark, we're actually offering a higher level benefit as far as what the organization pays versus the employees versus the market. All right, so that the one additional component to that, so the one thing you should be doing now in preparation or have already done before open enrollment is your Wellness Rewards program. There's 3 components to that. The first is what's called a Real Age test or a Real Age survey or assessment. It's done via the ShareCare website through Highmark Blue Cross Blue Shield. And essentially it's just a 5-minute survey, helps you determine, if you're leading a healthy lifestyle and what you need to do to improve your health. For instance, you go in, you fill out some questions. I know my age. It told me the first time I was 15 years older than that because of the lifestyle that I live. So I went in and lied to it, and then I became out, I was only 20 years old, so I felt pretty good about things at that juncture. But essentially, just be truthful. It is completely confidential. No one has access to the results. It's just for you for planning a more healthy lifestyle. The second piece is a tobacco affidavit. Are you tobacco free or not? If your spouse is on the plan, they have to do these things as well. And then the third component is having gone to your primary care physician for what's called a wellness visit or an annual visit or preventative exam within the past 18 months leading up to October 30th of this year. If you did all 3 things and your spouse is on the plan and done it as well, then it waives the penalty, which is a premium for the tobacco component, and you get a reduced deductible of $500 for an individual plan or up to $1,000 if you have the family plan. So just be sure to have that completed by the 31st. There's nothing you just need to submit if you've had that wellness visit, and that's because they actually pull those codes directly from Highmark Blue Cross Blue Shield. Any questions about benefits before I pivot? All right. So historically, we've done performance appraisals for hourly employees, also known as non-exempt, around the October timeframe. This year, we will be delaying that because we're going to be moving to system performance management, and we're going to be moving away from using paper or Word documents and moving to AltiPro. So what's that mean? For this year's performance period, which is this calendar year, you'll receive a performance appraisal from your supervisor in the first quarter of next year. Those who are salaried will also receive it at the same time. So now we're going to standardize when everybody gets it at the same time. A few things that will be changing. First, it'll be electronic. It'll be workflow, and you always have visibility to it. It's not a piece of paper that can get lost. It has to be keyed 100 different times. We'll have 2 different appraisal types. We'll have the individual contributor, which is defined as any person who's not a supervisor of others, and then one for leadership. And the competencies will be a little bit different because the roles are different. But everybody will be evaluated on their job duties, of course, because that's what you spend your most time doing. Your core competencies, just like the competency checklist you have on your units or departments. And then goals, especially for management and leadership, so that we have trickle-down or cascading goals. We'll have a 1 to 5 rating scale with very clear definitions of expectations. Right now, we're a little compressed and doing a 1 to 3 scale. So what does all this mean? Well, it's a stepping stone, and it's a stepping stone that'll take a couple years. We work in a seniority-driven system, aka years of experience drives your compensation. There is the desire, but it's a paradigm shift to get to merit pay. And merit pay means you actually earn compensation or compensation increases based on your level of contribution to the organization in reaching the mission and vision. So therefore, if you exceed expectations, And that type of program, you have the potential to get a greater increase on an annual basis than maybe somebody who's coming in and may have a performance issue or an attendance issue. Right now, we really don't look at that for compensation, but it's going to take a while to get there because we have to standardize that across all the facilities within the system because compensation is administered centrally as a shared service. So that's one step, and then the other piece of that is incentive compensation for management levels. So this is a builder's kind of phase one to moving to, everybody doesn't get the same increase every year, which is the current reality. All right, licensure. So right now, I want to preface this with continue to do what you are doing. But we are moving to a third-party administration of licensure. And the intention is to do it by October the 1st. And the reason for that is that's our biggest wave of RN licensures in the state of West Virginia, as long as you don't have the compact license. And so the intent is to do daily primary source verifications against everybody's license so that we can show a surveyor and accreditor every day that we're checking that. And it reduces the risk that somebody could slip through the cracks when we're running reports and potentially be working without a license, which causes a lot of issues with compliance and payers. And so therefore, the intent is by October the 1st, you still have to maintain your license, make the payment, keep your CEUs or whatever is required, but at that point you would not have to upload any documentation into ALTI, which currently either you're doing or your supervisor may be doing on your behalf, and then you're changing some fields to keep that current in ALTI. The intent is to eliminate that manual process on the back end where we'll be verifying it automatically, and then of course if you're not keeping your license up to date, we'll know in advance and on the date and can reach out and take necessary action as necessary. So with that being said, we hope to have this in place by October the 1st. It would be a great benefit to you administratively and to us to ensure compliance, but continue to do what you're doing now unless you hear otherwise, because we want to make sure the system's live and you don't just stop uploading your documents. And we're in a scramble come October 31st, and we've got 600 nurses who don't have their licenses in the system. Any questions for the Wedding Crashers? Everybody knows the Wedding Crashers, right? If you don't recognize, that's me right back here. I'm just kidding. Thank you.
Thank you, Mr. Rubel. We did have, in my 13-year career here, we did have 3 people that did work without license. And someone named Debbie Lupkin was on top of it, and we had to credit back all any patient that she touched. All of those bills were credited back, so it was a tremendous loss. So make sure your license is up to date. This is just symbolic of an integration with Children's. The 3 neonatologists are there, and of course starting with Dr. Yosik, who started here and has done a tremendous job of treating our infants here at Berkeley as well. This is the new Children's Hospital at Ruby. If you're facing a hospital, you see the main entrance to the right, you see the HVI tower, then you see a 9-story Children's Hospital. They are in the ground, a $300 million project, and I believe they're trying to get raised about $100 million to pay for a third of it, and it will proceed. If you can cut off maybe 3 floors of this, this is what Berkeley Medical Center will be building in the very near future. That hopefully will be in off of the emergency department entrance to the hospital. It's kind of the front entrance. There's the HVI tower and so forth. So people, here's our executive team. You just met Mr. Rubel. Henry Kerbin has just started with us. I said 3 weeks ago. He was in the room for the 2 o'clock. He said it was 3 months ago. So he's been with us for a while. Of course, you know everybody else on there. As you've heard me say 100 times, how do you create a good hospital? You have all the great people that are in this room. But in addition to that, you hire the best physicians that are out there. Tina gets tired of me telling this story, but when I did start here, we were in the process of recruiting general surgeons. They were handing me CVs, and I kept looking at the CV resume, and unbeknownst to me, I kept throwing them in the wastebasket. And she said, "What are you doing? That's who we're recruiting." And I said, "Not while I'm here. These are average people, and we want only the best that are out there," and that's where we started. So a lot of these have been filled, but there are tremendous needs. We had Stroudwater come in 5 years ago. and they identified a need based on population growth, age of medical staff, disease, illness, and things of that nature, a need of 75 additional physicians. We were in the process and recruited all of them, and so we had the study repeated about 2 months ago, and we're down to about 50 physicians of need now. Some of those that are in tremendous need are gastroenterology, MFM, to help augment the obstetricians and things like that. But OB-GYN, Erin Miller, Dr. Miller will start the day after Labor Day. She signed, sealed, and delivered. And so we're tracking 2 other ladies, one at WVU, McQuillan, and Lindsey Graham at Ohio State, and hopefully we'll attract 1 or both of them as well. Heart and vascular, as I mentioned, Dr. Bandwar is in the employment business of trying to get all those physicians to come, cardiologists to come to Martinsburg, that 333 rule, 3 interventional cardiologists in Winchester, 3 at Berkeley interventional. We have 1, we need 2 more, and 3 non-interventional, and we need 3 of those. A couple offers are out right now to some of these people, and then probably 6 advanced care people, providers, PAs, and others that help and supplement them. Oncologists, by the end of the summertime, we should have enough oncologists on board. General surgery, I'll show you a picture of Hannah and Mason. Dr. McKeever and Dr. Secor have joined us. We have 2 other general surgeons candidates we're sourcing as well. Probably a need for 2 to 3 additional ENT. Of course, you know Dr. John Crusoe joined us about a year ago, 18 months ago. His friend Dr. Lyerly has joined us 2 weeks ago. He's now participating. And next week, Dr. Lyerly has a good friend out of North Carolina, same location. This is how you get good people that will have dinner with us next week. So we may potentially be at 3 neurosurgeons very near future, and then 3 pain management people, 2 of which are already here as well. Psychiatry, for the first time that I've been here, 13 years, we finally will have enough psychiatrists. Now, one of the questions, there were 3 questions asked over the last 2 meetings. One was, are you going to do other outpatient type clinic? In the circle of psychiatry is we've done a good job inpatient, but we now need to get to the outside. There's a tremendous need for adolescent psych as well. So we need to complete that loop and get some additional people in. Orthopedics, we're in pretty good shape. Dr. Kemp just left CFOs with us as an employee. Dr. Richard, a shoulder person, has joined Jefferson, and we are tracking both Taylor Hockman, whose father's a good friend of mine, and Dr. Conti's a resident in Morgantown. He will join us in a couple years as well. So we continue to track them, and of course all the primary care. We have a ton of pediatricians joining us or have joined us. We'll continue with that. Hospice may be at their full complement very near future, meaning in the next month. And urgent care is pretty well trained now with our family medicine people taking a lot of that. Every 2 years we will ask you what you think. It's by way of formal, and we've asked that. And the reason for that is you guys have a lot of good suggestions for us, right? So I will tell the story even though I'm on camera because I love to tell it anyway. And mid-career of mine, I was responsible for a 600-bed nursing home. Daily census was 620, 9-story building. And so the best food in the county, Beaver County, was that you'd go through the serving line. So I go through the serving line. At the end of the serving line, there would be 3 ladies there and say, Mr. Tony, I said, what? So we got a suggestion for you. Okay, what's that? You administrative people were never around on the weekends. We got 600 residents looking for something to do, 400 are mobile, and we need to keep them moving, active, and things of that nature. So what we'd like to do is everyone, this was the second week in September, we'd like everyone to wear their high school football shirt or their pom-pom shirt or their cheerleading shirt or whatever. These are 80-year-olds I'm talking about plus staff. So we all did that. It was great. It was fun. So, you know, Beaver out equipping all these playing each other and doing that, have a great time. So I go through about a week later, and of course the second suggestion is, how about Saturdays? Well, okay. But we will wear our West Virginia shirt. We will wear maybe our Penn State shirt. We will wear our Ohio State college shirt, but we are not wearing University of Pittsburgh shirt. So a lot of the football players there did go to Pitt, but nonetheless. So we got Saturdays taken care of, so you know where I'm going with this on Sunday, because we are outside of Pittsburgh. So we are there, and so Mr. Zlinka, 2 weeks later, what are we going to do? We're going to all wear our Steelers shirts. So we had one little lady on the 8th floor that had that darn Dallas Cowboy shirt on. But anyway, so everybody wore their Pittsburgh Steelers shirt, and everybody's having a great time. So we're almost near the end of the season. Go through the line again. Mr. Tony, what's that last suggestion? What we're missing, what are we missing? We're missing a high school marching band. I'll take care of it. So we cleared the entire parking lot. Of 600 residents, 400 are in wheelchair. The other 200 are in bed and can't get out, so we wheel those to the window, take 400 wheelchairs out front of this 9-story building, empty the parking lot so the band's out there playing and everybody's having a great time, and continue that. So another great suggestions from our employees. And so the thing that almost brought me to tears was that the entire brass section, these are 15, 16, 17-year-olds, took it upon themselves to go up the stairwell and march up and down the 5th and 6th floor where all the people that couldn't get out of bed listened to them. That practice 15 years later is still being done today. So we encourage all the input from our employees, and hopefully we'll react to them. Finance, I'm switching gears here. We're big business, so that's that. Our business is to grow the business, so all of you have to help us grow the business. Most of the stats for the first 7 months, with maybe the exception of surgery, have been growing, so we need to do that. So tonight, or tomorrow night's Friday, right? So tomorrow night when you go to your local bar, your restaurant, make sure that you talk to your friends and say, look, Berkeley does the best thing here. Have your surgery done here, have your baby here, have whatever service you need done here. You need to go to the emergency department. They do a great job there too, and we do 48,000 as well, and so forth and so on. So we want to grow the business. You are all now employed in the marketing department. So, okay, you're there. But I also tell the story to orientation. So at orientation, I tell a little slightly different. So I suggest to them they have all now been promoted to the marketing department, and oh, by the way, if we don't grow the business and we do decrease the business, what are we going to have? Layoffs. Who gets laid off? All you people that were just hired. And so it kind of gets their attention, and oh, by the way, how many layoffs have we had in 13 years? 0. So we want to continue, and we'll continue to grow the business. We also like to make money. The good news is we made, for the first 7 months this year, we made a little over $4 million for the first 7 months. The bad news is the budget was $6 million. So we are expected to be very profitable, and we have been for the last 10 years. So why is that important? Because we take the net income at year end, add it to the funded depreciation, and that's how much I had to invest in your future for next year. Oh, by the way, who here would like a pay raise this year? Okay, so that kind of helps providing pay raises as well. So in addition to that, we have incentive comp, we have some other things going in there, and certainly benefits. No increase in benefits for health, you heard that, right? So we continue that. So we will invest in your future. But this old house, need to get to all private rooms, we need to pay for the addition, we need a new Toshiba down in the cath lab, so the list is fairly long. We have about 13, 14 million each year to spend on infrastructure and equipment, and we have requests of over $30 million. So we have to get down there and do that. So that's why profitability is important. The other thing I like to say at orientation is, who here would like to come to work and be understaffed? And then they go, what do you say? And I said, who here would like to come to work and be understaffed? We don't expect you to be understaffed. As my old boss would say, call me Zlinka. Zlinka, you got to match the workforce to the workload, and that's what we need to do. And so we measure that. So the easy math is, and I thought I saw ICU over there, so I use the ICU example that if we have 20 patients in ICU, we have a known 2-to-1 nurse ratio, so math's easy, we need 10 nurses for 20. Day after Super Bowl, 4 nurses called off, we only got 6. Unfair to the 6 nurses that showed up, and unfair to the 20 patients that had to take care of that day. So the moral of that story is at least show up for work. But at least we do and efficiently manage to match the workforce to the workload. These are the last 10 years of profitability, and so we are able to achieve the 2.5% margin. Some years we've done better than others, but in addition to that, we add, even I can't spend all that money, so what do we do with it? We put it into savings account, and some people called wealth management manage that savings account for us. So anyone have a CD this year or have the money in the bank or your return? First 6 months, what you get, 2% maybe on your return? Anybody want to throw a number out there? Probably, 4.0, 1.8. The hospital on their 60 million invested returned 14.8% on the first 7 months this year, roughly $6 million on 60 million saved. So again, old boss, no easier way to make money than have your money make it for you, so we continue to grow that money. So we have maybe 65 million in the bank. Well, that's really good. Anybody know what Inova has in the bank that Winchester's familiar with? $500 million. Anyone know what Highmark has, Western PA? Close to $1 billion. So we're not there yet, but hopefully we'll become that profitable and get there over a period of years. Tony Zelenka likes to also spend money. So, So we've, of course, where would you spend the first 30 million? Well, anybody that's been here as long as I have, the first 10 years, go down to the emergency department, and we have people lying literally in the hallway. One happened to be a teacher that was lying there without something on her, and there was sewer backing up on the floors. And so it was small, it was ugly, and it was bad. And we finally got that done. And then, of course, ICU. If you remember the ICU, were you here in ICU those days? Okay, so they had a thing called the pit, I think it was, and they had 4 patients that literally feet of each patient almost touched each other. So that, what? The fishbowl, yeah, the fishbowl. So I had one inspector just had a kidney thing done, and he said, I said, it's ICU. He said, I'm not going in there. So anyway, we obviously replaced ICU at 20 beds, and then the ED, one of the busiest in the state of West Virginia, had to redo it, and we did. And Jefferson as well, as a matter of fact. So MRs, CTs, Epic. We spent $12 million about 8 years ago on Epic. Anyone at Meritus know what Meritus is spending? Close to, I heard the price tag right now is running about $68 million for their Epic system install. So we got ours at 12, but a guy named President Obama gave us a check for 6 under something called meaningful use. So the net out of that was about $6 million. So we continue to spend and invest in your future, and we spent well over $100 million. Why would we do that? Because my dad worked for U.S. Steel in Pittsburgh. What's that mean? U.S. Steel never invested in their people, never invested in plant and technology. Today, 60%, 70% of the specialty steel in America today is imported from China. That will not happen here. It will not happen at Berkeley. We will invest in the future. So services, again, 3-4 years ago, 70%, and there were quite a few discharges out of Jefferson Hospital because they are a critical access hospital. Their ED will transfer, their inpatient will transfer. 70%, 80% of their patients went out of state. You all know where they went. Today, 80% of the patients out of Jefferson Hospital are being brought to Berkeley. Why? Because the 2 people in back of the room. Right, Kimmy? And in addition to that, the hospitalists have their name tag with their name on the front. In the back it says, Mr. Zelenka says, say yes. So when they get a call, they are to say yes. So that's the call from Jefferson to transport that patient there en route. We take them. In addition, my boss likes this, is that Jefferson and Berkeley combined transported 80% of their transfers out of the state. Now 90% go to Morgantown. And so for that specialty care, they go to Morgantown. Now what happens is that's how we get the patients there with these guys. Another truck needed to be added and so forth and so on. But patients' families sometimes have a hard time, difficult time getting across town, let alone getting to Morgantown. This bus will pick up at Jefferson Monday through Friday at 7:30, Berkeley at 8. We'll take patients' families to Morgantown and back free of charge. Or about a year ago, I ran into a young mom that had a young daughter that needed to see a cardiologist specialist, a pediatric cardiologist in Morgantown. We make that appointment from 11:30. Don't have transportation, catch a bus. We'll make that appointment for you from 11 to 1. So those appointments can be made as well. And so we transport. This is the front entrance. Have you heard this before? Anybody know where that front entrance is? Anybody been to the Ritz-Carlton in Sarasota, Florida? That's what it is. So why is that? Because patient experience is based on hotel features. How good's the food? How about the temperature control, visitors? You know, how nice the security, how nice the security, leave me? Security, how nice security officer is out front, so forth and so on, but it's all perceptual too. They assume we're going to provide the quality and standard of care. All right, so we're in the cath lab. 2 cath tables. What's the measurement for STEMI? Door to balloon. Door to balloon nationally got to be 90 minutes. We are probably the best in the state at 54, 55 minutes. I think Lenny was in the earlier one that did not correct me, so I think that statement is correct. This Toshiba will need to be replaced this year, help do a bunch of peripheral stuff as well. And the second there, we've also, and especially, as you know, Dr. Sullivan, a thoracic surgeon, has signed, and we're hoping in the very near future a vascular surgeon will be with us. And so that's going to require something called a hybrid room. Hybrid room is imaging technology that can either be in the Toshiba room, cardiology, or it can be in the OR, to be determined. We'll wait till he gets there and let them tell me where it needs to be, and we'll finish that. Of course, the Philips talks to the Epic. Nice large ICU rooms, one of the things built, $65,000 there. 4 quality measures for emergency department. Door to door, less than 3 hours, done. Door to dock, less than 30 minutes, done. Troponins within an hour, done. Left without being seen, less than 2%, done. Done both at Jefferson and at Berkeley. So we do a real good job with that. Of course, we have tele-NICU as well, MRI, 2 of them on site, diagnostic. Second floor is well defined, won a national award for design. The second floor, the 4th floor, 5th floor, 6th floor, and 7th floor and 8th floor will eventually look like that. Probably not in my career, but it will look like that eventually for all private rooms. There's your private rooms. Radiology does, and this helps with vascular, a lot of peripheral vascular work. That's Dr. Plata, quite busy. And then, of course, we offer wound care on site. Most of these are off site. Wound heal rate is what? 0%. So that's helpful. If you get a script, actually I had one written this morning for me and had it filled, and I walked down today, about 15 minutes ago, and picked it up. So nice pharmacy. And if your boss gives you indigestion, you can go down and get Pepto-Bismol and something like that, and maybe get a bottle for him or her too. And so we have a drive-through for that. 4 modalities for cancer oncology. And so this is all being redone, doubling in size, certainly surgical removal. Dr. Rosenshine, gyne-onc out of Hopkins, is now with us. And these are our 2 new surgeons. So they are on exit 20. I believe this was on a 3-month medical leave due to something called a baby. And so they'll be with us and doing quite well. Dr. Kay's been with us for 18 years. So the latest and greatest radiation oncology, we provide the IMRT, SBRT, being to the cancer and so forth and so on, does a really good job with that. And then Bonnie's bus goes throughout the county. We do a lot of mammo as well, screening diagnostics on the weekend. We own and operate a wellness center on campus. Who here belongs to the wellness center? Okay. Tony Zelenka has 1-week passes to the wellness center. So anybody that wants to try, if you're at Gold's Gym and pumping heavy, you can go over here and really try a different workout. And Brandon will help you with that workout and these Italian equipment. So I suggest we're 3,000 members strong, and hopefully we'll get better in that regard. There's Zach giving the little class there too. $22 a month. MOB3 across the street, buildings filled, done, and complete. Mostly surgical on this side, clinics on this side. So there's your surgery center, waiting room. Single story, so a lot of outside light being introduced. 12 bays, pre-post, 4 ORs. I said they had a large contingent here at the 2 o'clock session. I said by mid-year, definitely by this time next year, they will be at 100% capacity. I said, well, that's the good news. Bad news is you might have to start working Saturdays. So they booed me, but anyway. And then everybody else in the room was saying, I work weekends all the time. So anyway, so the brain and spine center is there, of course, and that's what we've done neurosurgery with 1 guy. That should double over the course of the year, and that's John Caruso right here. Some other neurosurgeons in there, waiting room, exam rooms. Would you want to explain what this is?
My cafe.
Okay.
Cafe at MOB3.
So that's the cafe at MOB3 and offers a lot of good quality food as well. Anybody been to Kobe restaurant off exit 13 in that strip mall? 2 doors down from that is your sleep center, is our sleep center, both Jefferson and Berkeley combined. That's the mayor of Martinsburg. And so we have that plus their own individual toilets off of that too. And 2 doors down from that's our training center. Do a nice job there, good access. Home care, the durable medical equipment headed up by Judy Hockman will report to Morgantown November 1st. And so home health started 2 months ago, and they also report to Morgantown. Dotted line to me, but it has now become a system endeavor for both home care and durable medical equipment. Anyone in Wood, exit 5, so all of this. Okay, so you see what that building looks like, urgent care, primary care, and a little rehab at the end. If you're going toward Shepherdstown on 45, right before you get to the four-way intersection, on the left is what? Domino's Pizza. On the right, before the intersection, is Sheetz. About a block up across from Domino's, we will build this building this year, and it will be opened up May 15th of next year. So that also coincides with our graduates, so we can hire all of our family medicine graduates and locate them in this building as well. But it's the building's under contract, actually. We just need a Department of Highway Access thing. 340 going there. Exit 20 off 81, 2 floors of MOB, Spring Mills, 3rd floor is empty to be determined. Doing a good job there. Bardane, of course, quality job 1. As our Medicare and all payer length of stay increases, not well over 5, but over 5, 4.2. The reason to a degree of that is that we have higher acuity. Case mix index also increases. So as case mix goes up, length of stay slightly goes up too. So some of the quality measures there, and these are mostly infections, return to the hospital and things like that. We do a real good job with that. And in addition to that, Highmark in 1983, when I was in Pennsylvania, they reimbursed hospitals an incentive for doing the things you should be doing anyway. From a quality standpoint, you have to score an 85% or better on a 100-point system. Last 2 years, thanks to Barb Sherman and others, we have scored greater than 100. So they pay us or incentivize us to perform that. That's the dollar amount we received a check for. So it pays to perform. And so that number is about the same every year, and Jefferson's about $500,000 as well. So Jefferson scored at about $500,000 as well. So we continue that. Press Ganey inpatient, you know, the 2-hour rounding, callbacks, things of that nature, 84. Of course, if we had all private rooms, I truly believe this would be in the 90s as well. Outpatient lab x-ray accessibility, 93. One-day surgery. I know the MOB3 is about 95, 96% as well. And then emergency department, that door-to-door is about 85, not too bad as well. We tracked that obviously for years. This is Morgantown strategic planning, and we are part of that and make sure we coordinate with them. On this one, this is our local plan, and it basically says that we will want to recruit and retain physicians, that 25 I said. But we also want to recruit and retain quality employees. So if you were going to leave here and seek employment elsewhere, why would you do that? Why are you going to leave us in next month?
More money.
More money, okay. Anything else?
Benefits.
Benefits. Money is 4, benefits is 5. Number 1 is you don't like your boss. Number 2 is your boss doesn't like you. Now, it's not like or dislike, it's communication and doing what you're supposed to do within the scope of your job description. And so that lack of communication sometimes leads you to find another job. I left a job one time in my career, and I've only left 3 jobs in 40 years of career, and the one time was because my boss didn't like me and I didn't like him. You know, after about a year or 2, I said, I got to look somewhere else, and after 22 years, I started looking somewhere else and left. So it does happen. The third sometimes is that you get a shift change. If you were hired 9 to 5 Monday through Friday, and one of your supervisors says you're going to work Friday, Saturday, Sunday, 11 to 7, I don't know about that. So, you know, communication again. So that's what that's all about, is retention and trying to keep good people, hire good people and keep them here. These are all quality measures. Blue Cross, I've gone through. This says grow the business, and this says make money. So we do that. So after 40 years of taking care of the sick and injured, now I've got to try and get people in Berkeley County to lose weight and stop smoking. Good luck with that. And so we're trying to continue that. And then the big 2 here is that Berkeley Medical Center is going to do a patient tower, hopefully, and Jefferson will do the same down there, an additional 50 physicians and private rooms. Construction at Berkeley Surgical, we will open up 5 additional ORs September 16th of this year. So September 16th, we'll open up these 5. The size of the existing OR is about this big, and we will double that in size. One of these rooms will be for primarily neurosurgery with 3, and then the other will be for hopefully cardiac surgery someday as well. and the Da Vinci, which will probably be here sometime next year. I'd hoped they're here, it was 2 months ago, but for different reasons, will be here sometime next year. Will go in this room as well. And so that's the second floor of this was built for this HVAC unit to serve that. I want to do it twice. And this potentially could be the entire 8th floor here, not NICU. The 8th floor here will fit on that second floor. Possibly HR will go there as well. And so all that will be hopefully infilled in the next several years. Once 8th floor vacates, aside from NICU, then this will all look like the second floor, all private rooms here. And so we're continuing doing, so these ORs are almost done and complete. A lot of new technology and different type of equipment and so forth and so on. Anybody at Dorothy McCormick, second floor, we're doubling the size of oncology. A lot of new things there. You come off the elevators, nice fireplace in the waiting room and things of that. Office space, doubling the size of exam rooms, doubling the size of infusion. Pharmacy made us do all this because of the way we mix chemotherapeutics. That's done, taken care of. So it looks great. Anything we do here, we do an outstanding job in terms of design and others, so we're carrying that through. And that will be done hopefully by year end. Jefferson Hospital, the back side of Jefferson will become the front side. The front side will become the back side. Hopefully this is what it will look like for the addition, one of these two. It will be either this side or this side for the front too as well. So we're trying to get that accomplished as we speak. All right, so if you walk into the emergency department now, as you know, the road's below it and it drops off like this, about a 32-foot differential. What we're hoping to do is the first level of this floor to be built over the road and over the pit, actually reroute the road, but into that area will be the reception area, Starbucks, gift shop, and things of that nature. I don't know if we're going to be able to afford the observation and peds as of today, but that's reevaluation on that. Second floor, we'll try to relocate the pediatric department and the 10 NICU beds. Did I say this? The census today in NICU is 9, and so probably 10's not even enough. MFM here, it might go to 15 easy. Third floor will be, we're planned for 1,400 deliveries here. We're currently doing 1,000. MFM, there's 1,500 in the county, should be able to get there, so plan for the future. Anyone think we have a parking problem at Berkeley? Okay, well, work Saturday, Sunday is not a problem. But if you go to Ruby, if you look at the left side and facing the stadium, there's a big superstructure parking garage there, and I think on the right side they're doing the same thing. The gentleman and company that did that superstructure design, costing, analysis, how many, because I can't build a garage for today, I got to build a garage for the next 5 to 6 years. We have that analysis done. I signed a contract Monday of this week. So it's being done as we speak. So there's different options to do parking structure, parking garages, and we're evaluating that now. This may be what it may look like, 2-3-story building attached off the emergency department into the pit, so to speak, parking maybe under that. Who knows, maybe across the street, maybe where the MOB-1 is. So that may be a superstructure 4-story parking garage there. To be determined, but evaluating it now. Most wired. Baby friendly, it's known that if moms breastfeed, it's good for the mom, good for the baby. And so 3 years ago, we were about 24% of our moms breastfed. And today, they're about 82. We did a lot of change there, including NICU. About 83% of the moms breastfeed at Berkeley. And the ladies there made it happen. And so we won a national award for that as well. Who knows anything about Joint Commission? Okay, they are our accrediting body. They will be here in the next 6 to 8 weeks. So our window of opportunity, as I call it, is now, and they will be here because it's a 3-year accreditation. They will be here in the next 6 to 8 weeks. They will be at Jefferson in the next 6 months, I would say. Commission on Cancer will be here in September. So they're going to be here to accredit our cancer program. We're level 3 trauma. 3 neurosurgeons start. We could go to level 2 not very easily because it requires some other trauma people to be here a little sooner, but it's to be evaluated as 2. That's our accrediting bodies. I am done.